Welcome to Northwest Vista College. This is HITT 1305 Medical Terminology. We put these slides together to hopefully get you comfortable and acquainted with the class and how it's going to work, and hopefully answer some of the most common questions that people have about this class and how to do well in it. So that is me. I am Alberto Vasquez, Professor Vasquez. I am a clinical engineer, and hopefully that background will be useful to you as you ask me questions. This is my contact information. I do not have an office phone because I do not have an office, but I have my email address. I'm more than happy to video conference with you if you're not close to campus and this helps you. Sometimes it helps with some people to see each other face to face, so feel free to use the video conference software to connect with me. For those of you in the virtual reality sections, feel free to use the VR meeting software. Meeting times are by appointment. If you are at work or you have other obligations, please just let me know and I'll be happy to find some time that's good for both of us. So, if you do need me, how do you find me? The very best way to find me is by using the Canvas email. The Canvas email has a nice benefit that I think often is overlooked. I cannot lose your email when you send it to me in Canvas. I can't get any spam in there, so I don't have to pick through the flood of junk mail that I get on my regular alamo.edu account. So when you email me in Canvas, you are the only people that I get emails from, so that's really the best place. My second preferred thing is texting me. Unlike full-time faculty, I do not have an office for office hours, so we will take a look at any other method of communicating that works with both our schedules. Remember, I'm here to help you, and for office hours, you can just contact me, but not only about course content. You can contact me if you have questions about registering for classes or questions about maybe some professional interests that you have, especially if it's in medical. So go ahead, feel free to bug me, and I don't mind. But then the last thing I do want to mention is you can always reach out to me at my just alamo.edu address, avasquez15 at alamo.edu. So let's talk about methods of assessment. How are you going to get a grade in this class? So this is out of the syllabus, so you might have already read this. We have it broken down into 5 different categories of how you're going to show me and demonstrate that you really have mastered medical terminology. We will have quizzes at the end of every module that is worth a quarter of your grade. The quizzes will be the textbook material as well as the lecture material, and there will be 20 questions per chapter or per module. There is one module where we are going to combine a few chapters, that's why I say that. Now, the nice thing about the quizzes is I am really trying to just give you an opportunity to show me that you understand the material. I promise you, I don't try to make them hard, and I don't lay in bed at night wondering if I can come up with a question that no one will be able to answer. So again, this is not to be stressful. This is just once a week, and there will be a quiz each week. You will have additionally 3 exams worth a quarter of your grade. There will be 50 multiple choice questions a piece with a little bit of extra credit. Questions will be from the lecture material and the textbook. We will have a final exam that's worth a quarter of the grade, which is going to be comprehensive. So that means everything we've done throughout the semester, all the way to the end of the semester. We will also have discussion questions at the end of your module that'll be worth 12.5% of your grade, and the exercises will also be worth 12.5%. So there's discussion questions and exercises combined that are worth the last quarter of your entire grade. The exercises I really have designed so that it will help you to practice and reinforce what we're doing during the week. So an important thing to tell you, I do not offer extra credit in this class for a couple of reasons. One, it's hard to come up with a very meaningful extra credit project in medical terminology, but primarily I don't offer extra credit because I have heard students say to each other, oh, I'm not going to worry so much about the exam, I'll just do some extra credit later. So sometimes people tend to think of extra credit as a safety net, and there is no safety net in healthcare. I just want you to learn the material. So what happens if something catastrophic happens to you and you miss a quiz or an exam? So I have a compromise for the no makeup policy. If you've missed an exam or quiz, I will let you take it late in the original format. So that means multiple choice. So if you're so sick that you had to go see a healthcare provider, all I need is documentation that you were seen by the healthcare provider with a date and the name of the healthcare provider. If you don't give me documentation, then you can't take the original format. That's all that means. So the second option is for when people's life just happens. So your boss made you work extra, somebody in the family got sick, life goes on. I will give you a fill-in-the-blank exam or quiz and that's better than a 0. So again, I do understand that things happen, but you can only do this twice during the semester. So those are your two options when it does happen. If it happens, just call me, email me, video conference me, and we'll figure out what to do from there. Some of the questions I get, the most common one is, how do I get a really good grade in this class? So in the second module, there is a section called Useful Stuff, and in it you will find a document where I've collected over the course of several semesters advice from former students. When we get up to the final, I asked them how they studied, and there's a lot of great studying techniques and ideas in that document. So take some time and look at it. It's worth it. So, there are people that have taken the course before you, so don't reinvent the wheel. Lean on that advice just a little. I would say, other than that, you have to read the textbook 30 minutes every day. So there's no law that you can't read each chapter twice. Look at your notes, lecture slides, anything that you have that helps you retain the material. 30 minutes every day, whether it's raining, whether it's your birthday, whether your sister came into town. 30 minutes is not a lot of time. It's a wonderful habit to develop, and it's probably the easiest and least painful way to prepare for class. So don't cram. So the last minute rush that everyone does, that is actually the result of when people don't study for 30 minutes every day. And this is very human. The other thing is, even if you studied for 30 minutes a day, sometimes people who want to get a good grade are really motivated and will make themselves just a little bit crazy and they'll go bananas. So cramming, the closer they get to the test, the harder they panic. And this doesn't do a lot of good things for you. What cramming accomplishes is making you feel insecure, because the more you cram, the more you feel like you don't know the material. It doesn't really cause you to feel confident, and when you don't feel confident and you take a quiz or exam, it really undermines your real ability, because it's that anxiety that causes you to have difficulty with recalling and remembering the stuff that you just learned. So don't cram, get into study groups, help each other. One thing I also want to mention is, obviously, I get into study groups, but also send me any questions if something doesn't make sense. Don't spend too long on an assignment if it's not making sense. Reach out to me right away. So look at your grades throughout the semester. Your grades will go into the grade book in real time, meaning within 24 to 48 hours after you do something. It takes me a little time to grade, but I don't let my grading pile up during the semester. I want to get to those grades in the grade books as quickly as I can, so you know what they are. So don't call me and say I'm worried about my grade without knowing your grade, because I will say, well, what is your grade? People say, I don't know, I'm afraid to look. It is so much better to just know where you are, because you're juggling a lot of things. Knowing what all your grades are at any given time is very valuable for you. Know what your grades are, and sometimes if you're afraid to look at your grade, you just have to do it. Anyway, it's just like getting on the scale. So that Monday, say after a Thanksgiving weekend, no one wants to know, but you can't make a good plan if you don't know what your grade is. So also, a reminder, make friends in the classroom. You know, those discussion questions, they are not just there for me to have something to grade, but to allow you to interact with each other. It helps make the class a lot more enjoyable. I made some good friends along the way in my online classes, and I hope you'll do the same too. So these are my bits of advice for you on how you can get a great grade in this class, and it is very doable. And just as a reminder, make friends in the class. So it's good to help each other out. And this is probably going to be one of the best ways for your academic career for you to be successful. So some other frequently asked questions I get is this: is this class going to be easier than face-to-face? I'm sorry to tell you that it really isn't. It's unlikely. It really is not going to be any faster taking it online. There aren't a lot of shortcuts that you're going to be able to take and still get a good grade. You have flexibility, but that doesn't necessarily mean that it's going to be easier, so don't get too confused. Another question I get is how much time should I spend every week? So I said that 30 minutes a day rule. You can spend at least as much time here as you would in a face to face class. Just because you don't have to sit in my very, very exciting lectures, it doesn't mean you're going to save time. It's 2.5 hours of classroom time that we would have together in a regular face to face class. Really, altogether, I think that you're going to put in about 6 hours a week. So 6 hours sounds horrible, but if you're doing the 30 minutes a day plus a little extra, 30 minutes a day, that's 3.5 hours, right? So there's really 6 hours. I think it's very reasonable. It's a very reasonable benchmark. Some chapters you're going to find a little more difficult than other chapters. That's just human nature, and that's just the way it is. So I say 6 hours. You might have a chapter. You can get it done in 5 hours. There, you might have a chapter you spend 10 hours on. But as a rule of thumb, I think 6 is a good starting point. What is the best way to plan for this online class? Okay, I gave you a clue already when I said 30 minutes a day. I want you to do that, but you sort of have to plan it too. So it's just like you plan to go to the gym, you make a plan for the class. Let's say you take the bus. I would study on the bus because that is dedicated time where I don't really have to do anything else that can distract me. So make sure you know what your plans are. Thinking that you're going to study at work is probably not good, especially if you get a lot of interactions at work. Sometimes thinking you'll study on your break at work doesn't work because then you have coworkers that want to talk to you. Also be aware that sometimes the people around you think that because you're taking a class and you're on a computer online, that you're not actually doing anything, and they'll interrupt you on purpose. And kids are famous for doing this. So if you have kids, right, they think you're just messing around online when in fact you're studying and doing work. So just make sure you speak up for yourself. You can always go to the Open Computer Lab here on campus, and I do have the links here on this presentation. What else should you think about? What else do you need to know about the online environment or a remote environment or some hybrid environment? So we can't see each other, which is obvious, but that changes a lot of the dynamics of how we interact. I can't tell when I've done a good or a bad job explaining something to you. In my face-to-face class, it's obvious because people will be looking at me with their eyebrows furrowed, and I'll say, do you want me to talk about that again? Even if they don't say yes, I know I need to go back and clarify some things. I have no clue in this class how you feel about the material, so you'll need to talk to me about things. Just because I know what I'm thinking doesn't mean that I can explain it, so you need to tell me what you're thinking. So don't feel uncomfortable or concerned if you must reach out to me and tell me that you're confused about something, and this is my job to help you get through this. I'll be more than happy to do that. I hope this presentation has helped a little. I'm looking forward to teaching you in this class, and I hope you're excited about it. Again, reach out to me if you need anything. I will talk to you soon.